All right, good morning, Dr. Jaffe. One of our customers writes in and would like to know how you make the choice in recommendation of either repair guard or pain guard for chronic inflammatory pain, and how would you dose the one that you choose?
Well, the last part of the question first. If you look at the amount of quercetin dihydrate and soluble OPC in pain guard, and you look at the amount that's in repair guard, you see that repair guard has twice as much as pain guard plus freeze-dried pomegranate juice that's ellagic acid rich, which is another enhancer of polyphenolic benefit. So 3 to 4 to 1. If you're going to take pain guard rather than repair guard, you would take 3 or 4 of the pain guard for every 1 of the repair guard. Now, pain guard has some virtues in that it's smaller, it's easily crushed. So if you have someone who has difficulty swallowing, you can easily crush up the pain guard. You can crush up the repair guard too, but it's easier with pain guard. You can easily crush it and put it into a smoothie, or put it into applesauce, or put it into yogurt, or put it into a sweet potato, so that it can be easily swallowed, even though it's been crushed. And if, for example, you have a youngster who's teething, I promise you, if you crush up a pain guard and smear that on the gingiva, smear that on the area that is swollen and painful. Very consistently, I've been told that the child quiets down, the pain reduces, the swelling reduces, the repair comes in, the tooth begins to erupt, that is, you want the tooth to come in. And pain guard is one of the gifts that you give to parents, or you tell parents about, when children are teething. Now, what about an elder who might have some gingival inflammation? They might have some repair deficit in their gums. You can do the same. Yes, you can take the pain guard or repair guard. Some people take both. And more importantly, you can take the smaller pain guard and get it in for people who have difficulty swallowing, or where you want to put it topically on a mucosal surface like the gums. So 3 or 4 to 1 in terms of comparing the active ingredients of pain guard with the potency of repair guard. We had such success with pain guard, and we realized that so many people needed to take so many pain guard that we developed the repair guard for those with more chronic repair deficit inflammatory situations, chronic illness situations. And I would say that of all the wonderful products that we've had the privilege of pioneering and documenting, the PERC repair guard and PERC pain guard consistently get even more superior appreciation from those who use them compared to anything else. So you know I'm not a fan of suppressing repair. I'm not a fan of NSAIDs and aspirin and ibuprofen and Tylenol and acetaminophen and so forth and so on. But I am a big fan of polyphenolics, the safer polyphenolics, quercetin dihydrate and soluble OPC. And we have been pioneering this since the late 1980s. We have included this in our community-based outcome studies to document benefits, both for the individual symptomatically and, more importantly, in the laboratory with quantitative results. So yes, we have PERC pain guard and PERC polyphenolic rich repair guard as fundamental to our supplementation family, but it is a family. You need the super multi, and you probably need some kind of enhanced detoxification support and supplement. You might need to regulate your blood sugar. You might likely need some more vitamin D, both K2, D3, and drops under the tongue. You most likely need more omega-3, but micellized and distilled under nitrogen. You might likely need more antioxidant protection in your nucleus, and that's where the 8-oxoguanine predictive biomarker test comes in. So fortunately, with the help of modern clinical biochemistry and laboratory medicine, which was my wheelhouse when I was at the clinical center of the National Institutes of Health, Fortunately, today, we do know the correct predictive tests, the predictive biomarker tests that cover lifestyle and epigenetics, and how to use that information to guide practices that bring you to your best outcome goal value and reduce risk while improving outcomes, helping you feel and function better, even in these stressful, hazardous times.